Hello guys, today we'll be talking about candidiasis and we'll be talking about candidiasis under the following headings: introduction, causative agents, pathogenesis, epidemiology, risk factors, diagnosis, prevention and control, as well as treatment. What is candidiasis? Candidiasis is a common opportunistic fungal infection that is caused by yeast of the genus Candida. These organisms are common human commensals found in the human body, and they colonize mucosal surfaces of the oral cavity, gastrointestinal tract, genitourinary tract, as well as the skin. Under normal physiological conditions, Candida species are able to coexist harmlessly with the host and also with other members of the normal human microbiota. But when the host immune defenses are compromised and the balance of the normal flora is disrupted, Candida species proliferate excessively, causing disease. Candidiasis ranges from superficial, localized infection affecting the skin and mucous membrane to systemic as well as life-threatening and severe infection involving the bloodstream and internal organs. Superficial candidiasis includes oral candidiasis of thrush, as well as vulvovaginal candidiasis, cutaneous candidiasis, as well as diaper rash. Invasive candidiasis includes candidemia and deep-seated organ infections. Because of its wide clinical spectrum, as well as increasing prevalence, especially in immunocompromised individuals, candidiasis poses a significant public health and clinical challenge. Let's talk about the causative agent of candidiasis. The causative agent, or candidiasis rather, is caused by yeast-like fungi of the genus Candida. They are caused by yeast-like fungi of the genus Candida and the class Saccharomycetes. Candidiasis is caused by yeast-like fungi of the genus Candida and of the class Saccharomycetes. There are more than 200 known species of Candida, but only few are pathogenic to humans. The most common and clinically significant species of Candida is the Candida albicans. Candida albicans is the most common and clinically significant species of Candida that is responsible for causing candidiasis. Candida albicans has or causes a vast majority of mucocutaneous and invasive infection of candidiasis. There are also other species of Candida that are also clinically important, meaning that they are involved in causing candidiasis. Some of these species include Candida glabrata, also Candida tropicalis, Candida parapsilosis, Candida crucia, Candida auris, among others. These are some other clinically important species of Candida that are involved in causing candidiasis: Candida glabrata, Candida tropicalis, Candida parapsilosis, Candida crucia, Candida auris, etc. These species have different or distinct virulence, antifungal susceptibility, and epidemiological distribution. Candida species are dimorphic fungi, meaning they exist in yeast form, but they can transition to pseudohyphae or hyphae or true hyphae forms. And this characteristic plays a very crucial role in the pathogenesis of the Candida species. Candida species usually reproduce asexually by budding, and they're usually isolated in the normal human flora. Let's talk about the pathogenesis of candidiasis. The pathogenesis of candidiasis involves a complex interaction between the host immune defenses and the virulence factors of Candida species. Under normal circumstances, intact epithelial barrier, normal bacterial flora, and effective innate and adaptive immunity, Candida species are not able to proliferate excessively, and as such, disease is inhibited. Disease of candidiasis usually occurs when host immune defenses are impaired. When this impairment occurs, Candida species utilize adhesins. They utilize adhesins, which are virulence factors that they possess. When impairment occurs, Candida species utilize adhesins to adhere, just like the name implies, adhesins to adhere to epithelial and endothelial cells, prosthetic devices, as well as catheters. The ability of Candida species to transition from yeast to pseudohypha and hypha forms is very essential as it enables tissue invasion as well as evasion of the host immune responses. Hypha forms are able to penetrate epithelial layers, causing tissue damage. Candida species are also able to form biofilms, and this helps to protect the organism, that is the Candida species, from the activities of the host immune response. And it also helps in reducing susceptibility of the organism to antifungal medications. In invasive candidiasis, Candida species enter into the bloodstream, and this usually occurs due to impaired or disrupted mucosa barrier as well as contaminated intravascular devices. Once in the bloodstream, Candida species disseminates into various organs such as the kidney, liver, heart, and brain, leading to severe systemic infection. So this is basically about the pathogenesis. Let's talk about the epidemiology of candidiasis. Candidiasis has a worldwide distribution, and it affects individuals of all ages, from neonates to the elderly. Superficial candidiasis is extremely common, especially oral and vulvovaginal infections. Very important. Also, it is also important to note that it is estimated that a large proportion of women experience vulvovaginal candidiasis at least once in their lifetime. Invasive candidiasis is a major cause of morbidity and mortality in hospitalized patients, particularly those in the intensive care units. Candida species are a leading cause of hospital-acquired bloodstream infections globally. The epidemiology, however, has shifted in recent years as increasing prevalence or diseases are caused by non-albicans Candida species, with some of them exhibiting resistance to commonly used antifungal agents. Emerging species of Candida, such as the Candida auris, pose a significant public health concern due to their multi-drug resistance, as well as ability to cause outbreaks in healthcare settings and difficulty in laboratory identification. Let's talk about risk factors associated with acquiring candidiasis. Certain risk factors are certain risk factors make individuals susceptible or predispose individuals to acquiring candidiasis. These risk factors include immunosuppression, immunosuppressive conditions such as HIV/AIDS infection, organ transplantation, cancer chemotherapy, and prolonged use of corticosteroid reduces the effectiveness and efficacy of the immune system, thus predisposing to candidiasis, which happens to be an opportunistic infection. Another very important risk factor associated with candidiasis is use of invasive equipment such as indwelling catheters, implants, as well as prosthetic devices. Also, also very important as a risk factor of acquiring candidiasis is pregnancy. Pregnancy, right? The hormonal imbalances and changes that occur during pregnancy predispose individuals to vaginal colonization by Candida species. Also, diabetes is a risk factor as well, because poor glycemic control generally favors fungal growth. Also, prolonged hospitalization and stay in the intensive care unit is a very important risk factor because Candida species are leading causes of hospital-acquired bloodstream infections globally. So these are some of the risk factors associated with acquiring candidiasis. But let's talk about the diagnosis of candidiasis. The diagnosis of candidiasis is based on clinical presentation, sites of infection, and laboratory investigation. Direct microscopic examination of clinical specimens that are isolated, right? Direct examination of clinical specimens using KOH or the potassium hydroxide preparation reveals budding yeast cells as well as pseudo-hyphae. Culturing is also an important diagnostic tool. Culture of specimens on Saborodestros agar, that's SDA, Saborodestros agar, produces creamy and smooth colonies, and the special identification of these colonies is usually done using biochemical tests or automated systems. Blood culture is very instrumental in diagnosing candidemia, but sensitivity, however, is limited. Serological techniques and molecular methods are also very pivotal and crucial in diagnosing candidiasis. Let's talk about prevention and control. Prevention and control of candidiasis relies on reducing risk factors and also prevention of transmission, especially in healthcare settings. Some of the preventive and control measures against candidiasis includes rational use of antibiotics and antifungal agents. Very important. This helps to reduce the disruption of the normal flora of bacteria, of the microbiota, as well as helps to maintain susceptibility of Candida species to antifungal medications and agents. Also, proper management of underlying conditions such as diabetes is very important as well. Also, strict adherence to infection control strategies in hospital and healthcare settings, and proper care and timely removal of invasive devices, medical devices such as indwelling implants, catheters, and of course, and prosthetic devices. Let's talk about prevention and control about treatment rather. The treatment of candidiasis heavily relies on the site of infection, severity of the disease, and the immune status of the patient. Superficial candidiasis is usually treated using topical antifungal agents nystatin, such as nystatin, clotrimazole, and miconazole. Topical antifungal agents such as nystatin, clotrimazole, and miconazole are usually used in treating superficial candidiasis. Oral azoles like fluconazole are very instrumental in treating recurrent and severe infections of superficial candidiasis. Invasive candidiasis is usually treated using echinocardins such as Caspo caspofungin, as well as micafungin. Echinocandins such as caspofungin and micafungin are very instrumental in treating invasive candidiasis. Amphotericin B Amphotericin B is used in treating severe and resistant infections of invasive candidiasis. So this is basically about the treatment of candidiasis.